Hi, today I'm gonna go over some of the muscles of facial expression, especially when we do Botox. So as you can see, she doesn't have any static wrinkles. Static wrinkles are wrinkles that you see when she's not making any facial expression. There is a little light one being formed here, but raise your forehead for me. So that is when we see these are dynamic wrinkles. And so the forehead, first the forehead. The forehead lines are, raise them up, are because of this muscle that extends from here all the way here. And its job, it's called the Frontalis muscle. Its job is to lift the eyebrows up. So every time you lift your eyebrows, you're getting this muscle activated. And what it leads to is the presence of these lines here. So go ahead and lift it more and relax it. So these are the lines. Now just for demonstration purpose, I'm marking these up for you, but normally we don't have to mark these. Now Botox will inhibit the movement of that muscle, and when you prevent it from moving, then the muscle relaxes and the wrinkles go away. So the key with the forehead, one thing about the forehead is that you can't do too much of it. If you do too much Botox on the forehead, then the entire eyebrow drops down, and we certainly don't want that. Now, frown for me. Frowning is because of two muscles. One is, relax it now, is the corrugator muscle, which its action is to actually bring the eyebrow in and down. So go ahead and frown one more time, and it leads to these lines here. So as you see these lines here, these are sometimes called the frown lines or the 11s. And the second muscle, so there's one here, corrugator, another corrugator here. The second muscle is the muscle deeper to it. It's called the procerus, and it leads to, go ahead and frown again. So it leads to this bunching that you see here. And go ahead and relax it, and it brings the eyebrows down. Now, typically when we want to prevent the frown lines, we go ahead and inject Botox in these spots, one here, 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 and here, and that prevents the movement of that muscle and relaxes that muscle. Now the last thing is a common area we inject, so go ahead and smile for me. And the smile lines here, relax it now. The smile lines happen because of the orbicularis muscle, which is a circumferential muscle. Go ahead and smile. So as you see, it extends. It's a circumferential muscle, which means it's all around the eye. Its function is to actually close the eyelids. So obviously we don't want to prevent you from closing your eyelids, so we go ahead and inject it, typically for the crow's feet in this area and on the lateral side of the orbit. And by doing that, we're reducing that movement. Now, a lot of patients want to have their eyebrows lifted, and in order to do that, we inject a little bit into this area, and by doing that, we prevent the movement, the downward movement of the orbicularis muscle, and thus the eyebrow goes up. So, go ahead and turn this way for me. And so basically, the idea is to inject in this area, the forehead, the frown lines, and I'll show you how that's done in a second. So first I'm gonna do the frown lines. I want you to go ahead and frown for me and relax it. So as I mentioned, it's the corrugator muscle, the procerus muscle. We go ahead and put some right into the belly of the procerus. And again, typically for this area, I do about 15 units. Smile for me, big smile. And this is the orbicularis muscle, which leads to, now relax it. You see when she's relaxed, we don't see any crow's feet, but but injecting it here into the orbicularis prevents the muscle from moving, and thus reduces any of those lines. And at the same time, we're going to go ahead and lift her eyebrows a little bit to get a nice little lateral brow lift for her. Okay. big smile and relax it. So again, the orbicularis, little injection into it. You're gonna have a little pinch. You're okay? Is it getting too claustrophobic?
You just feel it a little more there because the skin's a little thinner than between the brow.
Yes. So go ahead and raise your forehead. So this is the frontalis muscle. Relax it. And go ahead and inject in this area. So I do little micro droplets. It's not too much, but I like to spread it into it. And again, too much Botox injection in that area is not a good idea because it drops the eyebrows. She's very expressive, so we want to really try to reduce those movements. And you know, this is not really a cookbook, so a lot of people tell me like, okay, how many units should I put here? How many units should I put here? The answer is, really it depends on the person, right? Every patient is different. Every anatomy is different. So she's getting about 35 units. Good. That's it.